Hi students, good afternoon. Today we'll discuss about the another diagnostic method, a very important diagnostic method in cardiology, that is echocardiography. So what is echocardiography? So before going to that, it is ultrasound. So you all know what is ultrasound, how it works. So the same way, when you do ultrasound to scan your heart, we say it as echocardiography. When you scan your heart, the high-pitched sound waves produce an image in the monitor, which gives various pictures of the heart in various angles. So that we say it as echocardiography. The sound waves are sent through a device called transducer and are reflected off the various structures. So it is the um, principle behind the echocardiography is as same like an ultrasound imaging. The sound waves which are transmitted through the transducer and converted into pictures in the monitor. If you see the components of an echocardiography machine, so this is the echocardiography machine, how it will look, and this is the image, how it will show it in the monitor. So we need a pulse generator which is inbuilt, transducer. So this is a transducer probe. So here you will apply gel and you will scan it. Receiver, so there is a receiver which receives and display the picture in the monitor. So it display, so we need a monitor and we need a receiver to CPU, and memory can be, you can store images in the monitor. So these are all the components of the echocardiography machine. So this machine will have a pulse generator, transducer, receiver, display and memory. So there will be a keyboard here, and this is the monitor. This will this is the monitor of the ECG of the patient, and this is the echocardiography monitor, and you can monitor all the images in this computer. There will be a keyboard and a memory storage will be there. Okay, so these are all the components of an echocardiography machine. Most of the ultrasound machines will have the same components. Next, indication. So why we need echocardiography? Scanning shows the internal structure of the heart. Okay, so the information on valvular structure and motion. So how the valves is moving, is there any damage to the valves, is there any inflammation to the valves, thickness of the valve, structure of the valves inside the heart. If you want to see the structure of the valve, if you want to see, you have to use an echocardiography machine. Cardiac chamber size and content. So what is inside the chamber, how much ml of blood is in each chamber after a diastolic or after at the end of the systole or end of a diastole, if you want to know. And the thickness of the myocardial um, ventricular myocardium, ventricles or atrium, the thickness, if you want to see, we need the echocardiography. So cardiac chamber size and the content. Sometimes if the patient is having an stagnation of blood in the chambers, what happens, if the pumping is very poor, what happens, the ventricles will have the blood stagnated inside, and so may cause some blood clots, which if it pumps, what happens, it breaks up into tiny emboli and travel to the um, especially to the heart, because the first branch of the aorta is cardiac, that is coronary artery, and the next branch is it goes to the brain, causing stroke. So the blood clot inside a cardiac chamber is very very dangerous. So if you want to assess any thrombosis formation inside the cardiac chamber, cardio echocardiography is the best one, because cardiac chambers are moves because of systolic and contraction and um, retraction. So what happens, the thrombus may breaks up into pieces and moves wherever it wants. If the thrombus is in the right atrium or right ventricle, it goes to the pulmonary artery, causing pulmonary embolism. If the thrombus is in the left side of the heart, it goes into the systemic circulation. The very immediate circulation is like coronary and cerebral blood circulations. So that is, this echocardiography helps us to visualize those things inside the chamber. Next one is ventricular muscle. The thickness of the muscle, ventricular muscle, especially in case of cardiomyopathy or heart failure patient, we can measure it with the help of this echocardiography. Septal motion, that is same valvular septal motion, and thickness of the valves you can make out. The next one is ejection fraction. When you see an echo report, you will see like EF. EF means ejection fraction. So ejection fraction is nothing but the stroke volume, the amount of blood pumped by the left ventricle into the systemic circulation. We say it as ejection fraction. Okay, this has to be 60% above, and if it is less than 60%, it indicates heart failure. If it is less than 40%, severe heart failure. So sometimes patients with heart failure may come up even 20% of EF, that is ejection fraction. So you can measure the ejection fraction with the help of echocardiography, which is a very essential function in case if you are using it for an heart failure patient. The next one is pericardial sac. If a patient has a pericardial effusion, pericardial inflammation, you can view that in the echocardiography. Ascending aorta, so you can view the complete ascending aorta, so you can screen the aorta for aneurysm or dilatation or anything, any abnormalities. Congenital deformities in children especially, to identify congenital deformities, that is inside the heart or the structure of the heart. So the echocardiography helps in understanding the complete structure of the heart. Sometimes dextrocardiography, the heart will be present in the right side. The chambers may have exchange of chambers, or there is a hole between the chambers. You will be studying it in pediatric. A lot of congenital deformities are there in heart, and you can identify it through echocardiography. This echocardiography even sometimes they do when the mother is pregnant. Structural abnormalities, that is ultrasound, you can make out the structure of heart. Sometimes structural abnormalities, any kind of structural abnormalities, okay, like transposition of great vessels, the vessels like aorta and the pulmonary artery are positioned wrongly in congenital deformities. These things and all, the typical structural abnormalities, you can view it in the echocardiography. Cardiac mass, which is very very rare but sometimes happens, there is a mass or tumor in the heart, which also can be identified in echocardiography. So the indications are very very important, so you can use it in different places. Mostly we use in identifying valvular structure abnormalities, cardiac chamber size and contents, ventricular muscles and septal motions, ejection fraction in case of heart failure, pericardial sac to know whether the inflammation of the pericardium in case of pericarditis or pericardial effusion, ascending aorta, congenital deformities, structural abnormalities, and cardiac masses. Next, we'll move on to types of echocardiography. The echocardiography commonly done by transthoracic. So this is what I said, like ultrasound imaging. Here you can see, here this is transthoracic. What they do is they take the transducer and just put it in the heart, and they will visualize it in the monitor, which is called transthoracic cardio echocardiogram, that is TTE. The next one is transesophageal echocardiography, that is TEE. Here what they do is they introduce a transducer, which will be like a catheter, into the mouth, and they will take it into the esophagus so that they can go behind the heart. So if you want to see back of the heart, the best method is TEE, that is transesophageal echocardiography, where they will introduce the transducer into the mouth through the esophagus. At the back of the heart they will reach, and they will visualize the heart. So if you want to see the atrial thrombosis or visualize the backside of the heart, okay, the chambers whichever present, so this is the best way. Next one is stress echo or dopamine stress echo. Here what happens, like sometimes you want to see the function of heart when the patient is moving, okay. we say it as stress echo. So what they will do is they will ask the patient to walk in the treadmill and they will do the echocardiogram. So sometimes walking may not be possible because it won't give a clear image. So what they will do, they will introduce a medicine, that especially dobutamine. Dobutamine is used in the stress echocardiogram. What they do, they inject dobutamine injection, which increases the heart rate, the function of the heart. So we will come to know when you run how the heart is functioning. If you want to scan the image, you can do it dobutamine stress echo or pharmacological stress echo. What they do, they introduce some medicine, dobutamine injection, and they will visualize the heart. The next one is intravascular echocardiogram. What they do is when you are doing an angiogram, what they introduce the same probe, same like this transducer, they will inject it through the vein or an artery. So usually they do it, introduce it through the vein. So it goes into the superior vena cava and near that, inferior vena cava into the right atrium, so that they can visualize the or scan the internal structure of the heart very clearly. So they will introduce a probe as a very small catheter into the vein, and it will reach the inferior vena cava and into the heart, that is right atrium. Okay, so you can do intravascular echocardiogram also. This is usually done during the angiogram just to know whether everything is fine inside the heart. Okay, and your angiogram is also done in the same way. So they will introduce a catheter, along with that they will introduce a transducer also. So there are four types. Okay, transthoracic, that is a very superficial echocardiogram, which is commonly done. Transesophageal echocardiogram, if you want to visualize back of the heart. Okay, stress echo or dobutamine stress echo, and intravascular echocardiogram. So there are modalities of echocardiogram also. Like olden days, it was only two-dimensional echo and M mode echo, like black and white echo. Whereas nowadays we have Doppler and color Doppler echocardiogram, which are very specific, and you can see the images very clearly. Okay, so the advanced, very recent advanced one is color Doppler. Here I have given an image of a color Doppler, so you can beautifully view the heart image with the help of this color Doppler. So color Doppler and Doppler will give um, the deoxygenated oxygenated bloods also in the blue and red way. Okay, so you can uh, easily understand the structures and the blood circulation inside the chambers. So modalities means the newer techniques used in echocardiogram. It was started like a two-dimensional echocardiogram. Now it is three-dimensional color Doppler echocardiogram. There are M mode and color Doppler echo and color Doppler. Okay. The next one is nurse's responsibilities. If it is transthoracic echocardiogram, no preparation is needed. Just you have to inform the patient, get the order from the doctors, and make sure you are taking a right patient, and get a consent from the patient and shift him to the echocardiogram room. But if it is transesophageal, because you are going to put a pipe into the mouth, okay, some preparations are needed, like NPO should be given. Patient should be prepared in advance. You have to get a consent. NPO has to be prepared for 6 hours minimum. Patient should remove denture if it is present, because you are introducing a catheter. IV line, you may give a mild analgesics and anesthesia, so IV line is needed. Electrodes are attached and ECG is monitored, because you are introducing or you are touching, you may, the probe may irritate the heart at any moment as you are going inside the body, esophagus. Okay, so what happens, the heart may be triggered and arrhythmia may occur, abnormal rhythm. So patient has to be monitored with ECG. Blood pressure and SpO2 has to be monitored. Mild sedation is given through IV. That's why IV line is prepared. Endoscopic transducer is lubricated with a gel and introduced into the esophagus. Client is advised to swallow. So patient has to be conscious here. You cannot sedate him completely, because patient has to swallow the probe. The pictures and posterior heart is viewed clearly through the TEE. And after the procedure, the client's gag reflex is checked. So after the procedure, the main nurse's responsibility is, before giving any food or fluid, you have to check the gag reflex so that the patient is back to the consciousness. You have, because they are giving mild sedation, check the patient's conscious level. If they are conscious oriented, then give the sips of water and check the gag reflex has been gained, that is swallowing reflex, and then you will start giving them food. So this is the nurse's responsibility in case of TEE. Okay, the next one is stress dopamine. So if it is a stress dopamine, what is your responsibility? Same like that NPO, and you have to tell the patient not to take caffeine 24 hours before, and no counter over the counter pills, that is OTC drugs, should not be given, because some of the medications may trigger the heart, caffeine, smoking, all these things. So you have to advise them not to smoke and not to drink coffee 24 hours, not to take some medications like beta blockers, isosorbide, some of the heart related drugs. They may stop it, but tell them not to discontinue any medication without order. The doctor has to prescribe what are the medicines to take and not to take. And what you do, your patient has to be prepared with an IV cannula. ECG has to be monitored, same like TEE, that is transesophageal. You will be connecting them, monitoring them to ECG, heart rate, blood pressure, and SpO2. Dopamine stress test is given by 40 to 50 microgram per kg per minute. You will calculate per kg how much is the dopamine, and you will inject dopamine intravenously. And further, the heart rate you want to increase, you cannot increase the dopamine. What you can do, you can give atropine 0.25 to 1 milligram of atropine can be given. Clear? So this is the role of nurse in case of TE or dopamine. But for transthoracic echocardiogram, which is commonly done in most of the general hospitals, it is not, there is no preparation record, but you have to inform the patient you are taking to the procedure. Okay, and the need and the consent and proper right patient you should take it. Okay, clear? So we'll see in next class with a new topic. Bye.